Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years.
Hello, welcome to today's presentation, Sun, Beauty, or Beast, presented by Dr. Sunil Dhawan, dermatologist with the Center for Dermatology, Cosmetic, and Laser Surgery. Dr. Dhawan completed his dermatology residency at Mount Sinai Medical Center in Miami Beach, Florida. He is board certified with the American Board of Dermatology and the American Board of Internal Medicine. Dr. Dhawan is also an adjunct clinical assistant professor at the Stanford University Department of Dermatology, where he teaches dermatology residents and medical students. Please welcome Dr. Dhawan.
Thank you for having me. I appreciate the opportunity to give this short presentation on the sun, beauty, or the beast. That's me. I've been in practice in this area gratefully for the last 34 years and hope to continue to serve the community in this area and also in Milpitas. We have a practice of 8 providers actually. The skin, it's functioning as protection, temperature regulation, sensation, and secretion. The layers of the skin, the epidermis, which is the top layer here, the dermis, which is the second layer, and the subcutis, or the fatty layer, and then below there's muscle and other layers. The skin cell starts at the base here of the first layer and migrates up. It takes about 24 to 28 days. In certain conditions like psoriasis, it's faster. It forms a protective barrier, and there's oil secretion and glands next to these skin cells. Pigment cells are, of course, what help us have pigment. The lady on the right side here of me has more pigment producing cells and more pigment within those cells. The lady on the left has less pigment cells and less pigment production within each cell. The hair follicle is interspersed between the regular skin cells that are in the first layer and in the second layer. It consists of the sebaceous gland, the hair shaft, and the sweat glands, along with that are adjacent to the hair glands. The sun, it's the giver and taker of life. It lets us survive, gives us food, gives us sustenance, but also if excessive exposure can take it away. What are some interesting facts about sunlight? The risk of sunburn is greatest between 10 a.m. and 3 p.m. 90% of sunlight can penetrate cloudy or overcast days. Some light fabrics and wet clothes can transmit a large amount of sunlight to the skin. Hats and beach umbrellas do not provide full protection. Sunlight is reflected by sand, water, porch decks, and snow. UVA rays, which are one of the 3 components of rays that come from the sun to affect the skin, can penetrate glass and plastic. What is ultraviolet radiation? UV radiation is part of the electromagnetic spectrum, consisting of ultraviolet C, B, and A wavelengths between 200 and 400 nanometers. That's the wavelength of the light. UVC rays do not reach the Earth's surface. They're absorbed by the ozone layer. UVB and UVA rays are responsible for a variety of biologic effects on the skin, and you can see a description of where the ultraviolet and the visible spectrum and infrared spectrum would be. And if you take a prism, you can actually shine a light and you'll see these come up very, very quickly. Again, UVC rays do not penetrate down because they get blocked. UVB goes to the bottom of the first layer. UVA goes into the second layer and possibly is more damaging. So UVB radiation is a certain wavelength, 280 to 320. It causes burning, intense during midday, less intense during winter, more intense closer to the equator, and does not penetrate through glass or plastic. UVA are the skin aging rays. They're all day, all the time, through glass, through plastic, maintain intensity whether you're in the equator, North Pole, South Pole. UVB rays are mostly absorbed by the top layers of the skin surface. It can cause skin cancer, produces sunburns, tanning, photoaging, and photodamage. UVA rays penetrate deep into the skin, intensify the damage of the UVB rays, and may contribute to skin cancer, but also cause long-term damage, such as premature skin aging, dryness, roughness, wrinkling, and sunspots. What are some of the variables of sun exposure? Skin type is important. So we have somebody who's very fair-skinned, Northern European here, who has a fairly high risk of skin cancer because very little protection, very light hair. This gentleman does not have light eyes, but most of them have lighter eyes, and he burns pretty easily. He gets burned more than he tans. He almost always burns, he never tans. This is a little darker skin type. He's one of my friend's residents. I just met him a few weeks ago at one of our meetings. And he has what we consider a little bit more Mediterranean or kind of Middle European complexion. And he doesn't tend to burn as much as he tans, but he still burns occasionally. This is somebody more from Southern Europe, Middle East, India, Armenia, Iran, Afghanistan, that area. He tends to burn hardly ever or never and tans almost always. And this is somebody of African or Afro-Caribbean heritage who has never burns, always tans to some degree, and probably has the lowest risk of skin cancer. So if you go from the top, let me just show you here, the top left down to the bottom right, highest risk, moderate risk, lower risk, very low risk. But that doesn't mean these people don't get skin cancer. These two get skin cancer at a pretty fast clip, especially if they're living in Florida, had a lot of sun exposure, they were exercising outdoors, they worked outdoors, that sort of material. The time of day is important, as you saw with UVA, UVB. Sunny versus cloudy, more important for UVB. Geographic location, obviously if you're in Miami, middle of the country, or middle of the equator area, rather than being north of there, you'll get less UVB, but you'll still get UVA. Altitude, you're closer, Denver, those areas you tend to get more sunlight and sun damage. And reflection, of course, from sun, from the sand, the water, the porch decks, the snow. Ozone layer used to be a problem in the 80s and 90s. It's not a big problem anymore. That was because of hairsprays were killing the ozone layer and you were getting some UVC rays coming through. What are some of the effects of the sun? Well, you get sunburn, you get tanning, you get aging, allergies, diseases, and finally skin cancer. So people start out with sunburns when they're younger, start getting roughness, some pigmentation, some fine wrinkling, some deep wrinkling, some precancers, which I just saw a patient maybe not more than an hour ago, was in her late, I believe early 40s, late 30s, probably one of the younger patients with this, but already started showing signs of precancers like actinic keratoses. And finally, when chronic sun exposure is there, you get the increased risk of skin cancer. What does sun-damaged skin look like, so you can recognize it? Well, it tends to be what's called photo-aged or sun-damaged. It's wrinkled, sagging, tough and leathery, with red, yellow, or gray or brown blotches. It's got those brown spots on the back of the hands called liver spots, or on the cheeks. They're actually brown spots from the sun. And then they have precancers called actinic keratoses. This is the effect of sunlight, no sunlight and lots of sunlight. This is no sunlight, and this is lots of sunlight. You can see fairly even complexion. There's a couple moles here, and a little bit of blood vessels here, but as someone ages, you see all these fine wrinkles, lots more brown spots, some precancers, a lot of fine and heavy wrinkling. A lot of that's due to the sun, not just intrinsic aging. This is somebody who was a lifeguard in Miami Beach for 50 years, so quite a bit of damage here. Lots of bronze color up here, lots of wrinkling, tons of wrinkling, tons of damage. If you did a biopsy of this, you show tons of damage. And this is little Ozone Annie. The sun will come out tomorrow and she's burned to a crisp right there. You don't want to be like her. What are some of the benign skin growths that occur? Well, these are those little crusty spots that are called actinic keratoses. They're precancers, In and of themselves, they're not cancerous, but they can develop into skin cancer. The cumulative risk, if you have some of these, per lesion it's low, but globally, if you have more than 3 or 4 or 5, the risk is probably approaching 20-25% that you can get a skin cancer over long term. So you want to treat all these because a lot of these evolve into skin cancer. You can also have one right next to it that just appears like that. But this is a marker, so we treat these. Here's a more thickened and shaved over precancer on the left cheek. See all the brown discoloration from sun damage. These are some brown spots called liver spots, but they're actually called lentiginous or brown spots from the sun. They're very common and don't mean anything. But they're a marker. So we know that people who have these are at higher risk for skin cancer. These are called seborrheic keratoses. They look like somebody threw them on your back. They're benign. They're like stuck on the skin, like glued on, but they're totally benign. But they're again a marker for sun damage in some patients. What are some of the malignant skin tumors? Well, if you're asleep, this is the time to wake up and watch this presentation. The incidence of skin cancer and melanoma is increasing very rapidly, 15 times more common now than in the 1930s. Melanoma especially, probably because after World War II, a lot of us started recreating outdoors. Golf, tennis, Hawaii, Palm Springs. A lot of people go to Palm Springs from here. They burn the crisp out of themselves and they don't protect themselves. And then they wonder why they have these things. Fair-skinned, blue-eyed, blonde, or red-haired people have a very high risk of developing skin cancer. These are cancers. They're uncontrolled cell growth. The 3 types of skin cancer are basal cell, squamous cell, and melanoma. What's a basal cell look like? Well, it accounts for 84% of all skin cancers. Sun-exposed areas, face, ears, tops of the arms, back of the hands, ears, small shiny pink bump. You see it right there? That's a basal cell. It's a pretty large one, actually. You can see the damage this patient has. It's got very big pores, lots of blood vessels. Has been out in the sun quite a bit. Without treatment, they might bleed, crust, repeat the cycle. Can do serious local damage and eat away at parts of the face, the ear, the nose, lip, or eyelid. There were used to be called rodent ulcers, like a rodent was eating, a mouse or a rat was eating. This is a small basal cell, looks like a pearl with a small scab. It doesn't want to heal. This is a little bit bigger. This is the good, the bad. Let me go back to the good, the bad. And then this gentleman also has some precancers here, may have another skin cancer here. A lot of sun damage here, a lot of brown spots, wrinkling, been out in the sun quite a bit. And then this is a very large tumor, been neglected for 20 years. This lady actually eventually ended up dying from this because I think it penetrated into her spine, then went into her brain. So this is rare. I mean, probably 5-10 cases in the whole country of this. There's 5 to 7 million basal cells a year, but very few develop into this. This is usually from delay of diagnosis or just plain like not treating it. What's a squamous cell look like? It's about 14% of all skin cancers. Firm red bump on sun-exposed areas, very similar, face, ears, arms, back of the hands, upper back. Can spread to other parts of the body, which is rare, more common than basal cells, but still pretty rare. It's in front of the ear. This is a squamous cell. It's a larger squamous cell. It's been, again, neglected. I call this the makeup sign. The people try to put more and more makeup over these to hide them, but they just can't get rid of them. And this evolved from, you can see all the sun damage here. You got the wrinkling, you got the brown spots. This used to be just a flat brown spot, but it appeared at the site of the brown spot. The brown spot didn't evolve into it. It could have had a precancer. In fact, I think there's a precancer right there next to it. Again, those of you who are asleep can wake up now. What's a melanoma look like? Well, it's 1% of all skin cancers, but the most dangerous. It appears most commonly as a shaded brown or black spot, since malignant melanoma cells can still produce melanin. It can spread to other body parts and potentially kill you, especially when it goes to the brain or the lungs and the liver. Best treated when diagnosed early. The ABCDs of melanoma, we still use this in the practice. A is for asymmetry. If you draw a line through the center or a horizontal line here and a horizontal here, it's asymmetric, doesn't match. The border is irregular, jagged, notched, or blurred. The C is color variation with different shades of like over here, black, then pink, then brown, then lighter brown, patches of red, white, or blue, kind of a very patriotic melanoma, and the diameter is greater than 6 millimeters or the head of a pencil eraser. So if it's bigger than that and it's growing and it looks like this, you better run. You should have run earlier than this, so I'm sure it's been started out with something different. Here's a melanoma on the face. You can see how irregular it is. It's been evolving. They may have done a biopsy here. It's hard to tell. Here's a very thick, potentially fatal melanoma where it's now multiplying on its own and you know, has a big ability to spread. This is a fatal one. It's where it's coming out of the skin. This is you know, guaranteed to kill you if you don't take care of it. And even if you do it still may do that. So you want to detect it early. Melanoma will be fatal if not detected early enough. We can't spend more time on this. I want to spend more time on this one slide in the melanoma group because it's very important people realize this. So you think that you have a hard job. These are actually live people that do this for a living because women's noses are much more sensitive to smell, and this is an antiperspirant company, I believe this is Gillette, or Colgate-Palmolive, I believe, that does this. Prevention and treatment. Skin cancer should be treated by a dermatologist or other MD who is trained to do this. It includes general surgeons, primary care doctors, plastic surgeons, but it tend to come to us first because we tend to see a lot of this stuff and treat it. What are the methods of treatment? Well, cryotherapy or freezing is old. We still use it sometimes. Not very effective, but can be used. Electrodesiccation and curettage, scrape and burn it out. That's another older method. Sometimes we'll use that, especially in patients that are more debilitated and don't want to have sutures. Surgery is a way to cut it out. We also have now creams that can be used, and there's a lot of advancement going on with artificial intelligence and figuring out certain creams and injections which may be more effective. That's coming in the next 5 to 7 years. Prevention. Well, avoid sun during peak hours. Go before 10 a.m. or after 3 p.m. Use sunscreen that's SPF greater than 30. Wear loose clothing that covers exposed parts and wear a hat. Avoid tanning, sunburns, or using tanning booths. These are the big four. Really the most important probably is this one, sunscreen, and avoiding tanning. Those are the top two. Don't do this. That's my last few days of Miami Beach and training. These guys were just, you know, roasting themselves. Don't do this. This is a sunburn. This is actually not true. This is from a Coppertone ad from the 90s, I believe. They painted this young woman with this you know, orange paint so that it looks worse than it really is. Sunscreens. Photo protection or sun protection. Apply a sunscreen or sunblock. Wear protective clothing. Like this lady's on the beach. She's got a hat, protective clothing, and a big beach umbrella. And she's got sunscreen in her hand. Sun protection factor. It's the burn time without sunscreen times the SPF equals burn time with sunscreen. So let me give you an example. If it's an SPF of 15 and it would normally take you 10 minutes to burn, with a 15 it takes 150 minutes. So it's not zero burning, it's just less. An SPF of 30, it would be 300 minutes or whatever that is, 5 hours, which nobody ever sits out for that long. So it's just the difference again, if you do the math in terms of how much light gets in between a 30 and a 50 is not much. And between a 50 and 100 it's even less. So we recommend between 30 and 50 is kind of the group that we would like you to use. We'd like you to be like this guy who's fully protected as an ex-headhunter from New Guinea. We'd like you to do this so it's completely soaking you, but I'm sure you can't do that. Best is SPF 30 or greater with zinc or titanium. Elta is a good brand, but they make multiple. Neutrogena makes one. Aveeno makes one now. They're all looking at zinc and titanium because the chemical sunblocks have an increased amount of benzene in them, and we're trying to avoid benzene. It's not a good thing to be putting on your skin. Here's some other ultra sheer, sensitive skin. There's a whole bunch of these blocks. Neutrogena is a good brand as well. There's one called Color Science, which is like a makeup sunscreen, SPF I think 30 with titanium or zinc. Don't forget the lips. We do see skin cancer on the lips as well. SPF 30 now. It used to be 15. You see it right here, it says 15. Now it's up to 30, 30 to 50 actually. So sunscreen recommendations, any brand with titanium dioxide and zinc oxide with SPF 30, UVB and UVA blockers that you will use regularly is okay. Other ingredients that are mentioned are good but can be more irritating and now have been found potentially to have potential for benzene, which is not great. Most are good. Look for ones that are lighter if you have oily skin or moisturizing if you have drier skin. You don't have to get the ones that are on TikTok from Korea. Most of those are chemical. You want to get the ones that are, you know, the ingredients, and the ones that are zinc or titanium mineral based. Price does not correlate with effectiveness. We have one in the office. I think we sell for about $30, which is higher than Neutrogena, but people are coming in and buying $50, $70, $80 sunscreens. I think it's overkill. You know, somewhere 20, 15, 30, something in that range, and they last me. I know exactly how long they last. I have it right in my bathroom before I leave, and I just put it on before I came here, and even though it's raining, I applied it because I don't want to get sun damage. Sprays are not as good as lotions or creams, but they're great for Hawaii. Apply 15 minutes before going out and reapply every 2 to 3 hours, otherwise the sunscreen's gone. Water resistance is only for 80 minutes and must be reapplied. So you can't just apply it once in the morning and hope it stays all day, or you're swimming in Hawaii with the sharks and it's there still. Always apply after any medication, such as those for acne. Put makeup over the sunblock. So it's your medication, sunblock, makeup. Those. Some makeups have sunscreen. Those with greater than 30 are the best, but 15 is better than nothing. 2 layers of SPF 15 does not equal 30. It's still SPF 15. It's just you're adding layers. The protection is that of the highest SPF applied. Recommendations, but these are some that I like. I use these all myself. Elta, Solbar, Neutrogena, Aveeno. Some of the cosmetic brands make, you know, L'Oreal makes a bunch of these. They're all good. The problem with some of the cosmetic high-end brands, even like Chanel and those guys that make sunblocks, a lot of them are chemical-based. The sunscreen companies that are very particular about formulation make the ones with titanium and zinc. The brands marketed under the name of a store are cheaper. So Target, Walmart, they're generally cheaper. What's the difference? Well, they tend to be oilier because they don't put a lot of money into the actual way it feels. They just give it to you to go to Hawaii. But if you had to do it every day, you wouldn't do it because it's too oily. So I have many patients say, you know, I said, where did you get the sunscreen? Oh, I went to Costco. I got a bunch of Neutrogena sunblock. Not the one I recommended, but one of those, you know, chemical ones. They said, well, I have it. I said, do you use it? They go, no. I go, why not? They said, it's too oily. So he's got a whole, he or she has a whole bathroom full of sunblock. They don't use any of it. Well, that's a waste of money and time, and they expire too. They are not used regularly because they're too oily or too greasy or have a smell. Or worse yet, for people with color like me, they leave a white sheen. That's terrible. So the lighter your skin, you never notice that, but when you have brown skin like me, you notice it, so you don't want to wear it. Vitamin D, not a big problem. Most of it's get in the diet. You can take a supplement. There's been much of an uproar has been created by the tanning industry to scare people. I'd like you to avoid tanning, please. And we see a lot less tanning booths than we used to. 20 years ago, there was a ton. Now, there was one in Fremont. I think it's gone. I think it's out of business. Good riddance. Do a monthly skin self-examination or early warning system. Do this if you're at high risk, not necessarily if you're at a low risk group. If you're like an 80-year-old, really dark skin, like East Indian, African American, you know, skin is just darker, you probably don't need to worry as much. But if you're a 50-year-old Nordic ancestry, Northern European, you better start worrying. This is the brochure we give everyone, or a lot of people in our office. It's now online too. It's American Academy of Dermatology. AAD.org has some really good information. We give out a website sheet to every patient now. Talks about websites, where to go. AAD.org is right on there. It's really good. This just tells you how to do a good skin self-examination, looking for moles on the back, the butt, all these areas. Look for growths or moles which are changing in size, color, and shape. Growths or moles which are itching, bleeding, hurting, or won't heal. Look for the ABCDS system. That's asymmetry, border irregularity, color variation, diameter, and S is symptoms. I apologize. I forgot about symptoms. That's very important. Asymmetry, irregular borders, non-uniform color, diameter, sudden growth, and symptoms. Itchiness, tenderness, pain. This is how you recognize a melanoma. Excessive tanning, sun exposure, and the number of sunburns is directly related to your risk of skin cancer and melanoma, and aging, and brown spots, and wrinkles, etc. Get a yearly complete skin examination by a dermatologist, personal physician if you're at high risk. If you're at low risk, you don't have a lot of moles, you've never had a problem, family's pretty clear of skin cancer, you don't need to do it. But Northern European, lots of moles, history of skin cancer in the family, or personal history of skin cancer, you got to get in there minimum once a year. Our melanoma patients are on a system. They've got sheets of information. They're on some supplements. We recommend some vitamin B6 supplements and some other things as preventatives, along with sunscreen use and protecting yourself. But if you're low risk, you don't need to do this. But most of us have spent a lot of time in the sun, especially those of us who lived in warm climates like Miami or Hawaii should probably come in at least once. Any suspicious growth should be brought to the attention of your dermatologist or physician ASAP. Really important. Some resources, we have the website links on our website, www.centerforderm.com, www.aad.org, and also the Mayo Clinic site's very good. You can punch in it like skin cancer and it'll pop up with tons of photos. This guy's out there suffering with no water, but he wants sunscreen. You can tell how old this cartoon is. I got this way long ago. 1993, the Orlando Sentinel. Long time. Thanks for having the hospital invite me to give this talk, and for all of you for attending. Those of you at home, that's our phone numbers and that's our email address. Now we'll open it up for questions.
Thank you, Dr. Dhawan. We have a couple of questions for you. The first one is, I have a family history of skin cancer. Do I need to see a dermatologist if I'm not having any skin issues?
If there's a family history of skin cancer, especially if it's in a direct relative like a brother with melanoma or a parent with melanoma, yes, once a year you should be seen because you're at higher risk. If you have an older relative like a mother or father who's had basal cell or squamous cells, and you've had enough sun, you probably should come in once a year. Chances are that they'll find some precancer, especially if you're follicularly challenged like me, especially on the top of the head, and also on the hands. But if you're dark-skinned, never had a history, nobody has it in the family, then probably not. But if you have a lot of moles, that's another risk factor for melanoma. You probably should come in, even independent of a history of skin cancer in the family.
Thank you. Our second question is, if I do get a sunburn, what advice would you give for a quick recovery?
First of all, I'd admonish you for why you did that, but that's because you probably forgot to wear your block or were roasting yourself without thinking too much, which is hard to do, I know, these days with everybody suffering in the rain here. So surprisingly, Advil or Aleve if you don't have kidney disease, or aspirin, a couple in the first couple of days, like 2 on the first day and 2 on the second day, relieve the inflammation quite nicely. And also a little bit of topical steroid like hydrocortisone or stronger triamcinolone that you can get at your doctor's office, or fluocinolone, which we use a lot. You put it on and you cover it with a thin coating of Vaseline. Works great. People feel much better in a day or two. But it's surprising how well a non-steroidal like aspirin, Aleve, naproxen or naproxen, if it's still available, and of course Advil, do quite well.
Thank you. This concludes our program. And thank you, Dr. Dhawan, for providing this information. And thank you to our viewers for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.